How to manage beta blocker dosage for hyperthyroidism. Managing beta blocker dosage for hyperthyroidism is an important aspect of treatment. Beta blockers help control symptoms like rapid heart rate, tremors, and anxiety while other treatments take effect. The goal is to find the right dose that alleviates symptoms without causing unwanted side effects. When starting treatment, a common beta blocker used is Propranolol. Typically, it is initiated at a dose of 10 to 40 milligrams taken orally 3 to 4 times a day. Depending on how severe the symptoms are, the total daily dose can range from about 30 to 160 milligrams. Other beta blockers, such as Atenolol, Metoprolol, Atenolol, and Thymolol, can also be effective and may be used at similar doses. The primary function of beta blockers is to lower the heart rate by about 25 to 30 beats per minute. This reduction helps relieving palpitations and anxiety that often accompany hyperthyroidism. It is important to note that while beta blockers improve quality of life, they do not directly affect thyroid hormone levels. Monitoring is crucial when managing dosage. Patients should be regularly assessed for symptom relief and heart rate. The aim is to achieve effective symptom control without causing bradycardia, which is a slow heart rate, or hypotension, which is low blood pressure. Certain individuals, such as those with asthma or specific heart conditions, should use beta blockers cautiously or may need to avoid them altogether. Beta blockers are generally used temporarily during the initial phase of hyperthyroidism treatment. They provide symptomatic relief until antithyroid medications or other therapies can normalize thyroid hormone levels. Once thyroid function returns to normal and symptoms improve, beta blockers can be tapered off under the guidance of a healthcare professional. It is essential to personalize the choice of beta blocker and the dosing regimen based on individual factors. These factors include the patient's age, other health conditions, symptom severity, and how well they tolerate the medication. For patients with respiratory issues, cardioselective beta blockers like Atenolol or Metoprolol may be preferred. However, Propranolol is often chosen because it also reduces the conversion of T4 to T3, which is the more active thyroid hormone. Common side effects of beta blockers include fatigue, slow heart rate, low blood pressure, insomnia, and gastrointestinal issues. They should not be used in patients with severe asthma or certain heart blocks without consulting a specialist. In summary, managing beta blocker dosage for hyperthyroidism involves starting with a moderate dose tailored to the severity of symptoms. Regular monitoring of heart rate and symptoms is necessary to adjust the dosage as needed. Once thyroid hormone levels stabilize, beta blockers can be safely discontinued. Always consult a healthcare professional for personalized advice and adjustments to treatment.